Welcome into Soda City Living and our special Soda City Sweethearts. Today, learn how to keep yourself and your Valentine healthy year-round. We're at Collaborative Healthcare in Lexington. Joining us is Dr. Connor. Thanks so much for having us.
Thank you.
As you can tell from the name, Collaborative Healthcare, it kind of tells you a little bit about the practice. So tell us a little bit more about how collaboration is kind of the basis of everything that you do.
Well, initially 20 years ago, we started out as a chiropractic only office. And about 10, 11 years into that, I realized that my patients had more of a need for different other services. So we brought in medical staff and we began to treat patients not only with chiropractic care, but focusing on weight loss, some of the testosterone issues that some of my male patients had, also sleep apnea, and with some of the cardiac care.
It sounds like your practice has kind of evolved based on patient needs.
Right, exactly. And one of the other things that we want to increase is that once we carry our patients through chiropractic care, we want to be able to stabilize the muscles around those injury sites, also help with some of the shoulder injuries, knee injuries that we see in here quite a bit. So we will be adding PT in the spring.
What is the patient range like, the age range?
The earliest I've seen patients have been 2 weeks old, and my oldest patient has been 102. I would say the average age of our patients is probably in that 55 to 60 year range.
Mm-hmm. And what are some of the issues that patients come in with? What are some of the chief complaints?
Generally neck pain, low back pain, tension headaches, migraines, arthritic symptoms, stiffness, and also one of my favorite things, kind of one of my biggest passions, is disc herniation.
Mm-hmm. So what are some of the services that you provide that help with those issues?
Well, we generally adjust. Number one, well, obviously when you come in, we'll have your paperwork. We'll do a full workup. We do an exam. We take X-rays so that we can see exactly where the problems are, how bad the problem is, how long it's been there, and then we make the call from there as to what type of adjusting schedule that you will be under. Sometimes we see people 2 times a week. Sometimes we see them 3 times a week, and then depending on how long the problem has been there, that also gives us the expansion for how long we're going to see that patient as well. If we see chronic arthritis, people that haven't really responded very well to adjustments or medications in the past, or someone who has radiating pain down the arms and legs, will generally administer decompression for the neck or low back.
When a patient comes in, do you ever work with other practices, or are you able to just help most people just within the practice?
Generally, we are able to help most people here. I mean, the great thing is that, since I've been here 20 years, I've gotten to know a lot of physicians in our area. So if there are conditions and things that we're just not seeing improving, or something that's just not in my field, then, it's just been great. I can refer to those folks, whether it be pain management or just general medicine.
Do you think there's anything that might surprise people about chiropractic if they've never tried it before?
I think the biggest surprise that I see are when we have babies in here. I'll see people's heads kind of go around the corner like what is he going to do with this baby? But we have gentle adjusting techniques. We have instrumentation that we can use other than my hand. But general conditions we see for the babies are reflux and ear infections, and that can all be related back to the nervous system. So something just as gentle as an adjustment can change that. Mothers are really happy.
Absolutely, and it's always great to start out with something that, of course, is non-invasive,
exactly,
and not surgery.
And then there again, if we're not able to help it in a short period of time, then obviously we'll refer out and try to get some help there.
Collaboration is the backbone of collaborative healthcare. Now let's learn about more treatments available for patients dealing with a range of health conditions and symptoms. We're joined now by Elizabeth, who handles another part of collaborative healthcare. So tell us a little bit about the services that you provide.
So right now we're doing the weight loss program. It's a 12-week program where it's specialized to each patient, and you would see me for 12 weeks every week, and I determine if I go up on your shot, or we decrease the shot, and I have a food sheet that we go over. I help you learn to eat correctly and exercise for the program, and I've seen a lot of success.
Wonderful. I'm sure that's a popular one too.
Oh, it is, yes.
Yeah.
So I have some guys and ladies coming off the program, and they've lost like 20 or 30 pounds already.
Amazing in such a short time period too, and just of course going to a physician and making sure that you're doing it in a healthy way.
Right. So
Yeah.
it's been really successful so far.
And you do so much more as well, like hormone replacement therapy.
Yes, I do. So that's, I'm seeing more guys right now for the testosterone, but it's helped improve like their weight loss too, and their sleep, and they just having more energy. So I really monitor them very closely too. They'll see me like 1 week, and then I follow back up with them about 2 to 3 weeks, and I do lab work on them too to make sure they're at the appropriate level.
So tell us a little bit about your background in healthcare.
So I became a nurse in 2008, and I've always done cardiology, and I worked at the Heart Hospital, and it was Palmetto Health. And then about 7 years ago, I became a nurse practitioner, and I've always done cardiology. And my wonderful mentor, we treated the whole patient. So you can't treat cardiology or cholesterol or heart disease without treating diabetes, lipids, hypertension, and even sleep apnea. So we treated everything, and so I have a lot of experience with the weight loss medication because of him. He's just been great.
So this seems like really the perfect kind of practice for you,
Yes,
because
ma'am.
you get to work with a chiropractor.
I do, yes. So it's been amazing. So
Yeah, I was going to ask how that's been, just being able to
Great.
have patients referred to you within the practice.
oh, it's been great. It's been amazing. So I've helped a lot of his patients with sleep too, because a lot of his guys especially have come in because they're very tired, and we do home sleep studies here, and we get them seen a lot quicker than they do at a hospital.
Wow.
So it's been great. And then I've also, some of his patients that they're hurting from being overweight. I've helped them lose some weight too, and their knees and stuff have felt better.
Wow.
So it's
So
been great.
what are some of the symptoms that you see a lot of patients coming in with?
So a lot of them are very tired, no energy. They've tried every diet in the world, and they're ready to change, and they need help, and they're ready to get better. So I start there. I do gradual, and I just kind of help them in all little areas.